We are continuing to highlight some of the biggest topics this Women's Health Month. And this week, we're talking about endometriosis, a chronic illness that affects an estimated 1 in 10 women globally. Take a look.
It took me 10 doctors to find someone that believed my pain.
I thought maybe I'm dying or I have some kind of rare disease. Then I go online and find that millions of women are going through exactly what I'm going through.
For those of you who don't know what endometriosis is,
1 out of every 10 women suffer from it.
The disease is a largely ignored aspect in women's health care.
The Below the Belt film follows 4 women and shows the everyday realities they face as they search for answers in their fight for a diagnosis. Endometriosis specialist and author Dr. Iris Karen Orbach is also highlighted in the film. She joins us this morning alongside endometriosis patient and advocate Sarah Ramos to give us more insight. Thank you, ladies, for being here this morning.
Thank you.
It's such an important topic. This disease affects so many women, and yet it is still so misunderstood. Doctor, let's begin with you. For those folks who don't know what this disease is, can you explain?
Sure. So endometriosis is a chronic systemic body-wide inflammatory disorder that affects way too many, roughly 1 in 10 who are assigned female at birth, and that translates to about 200 million women worldwide. And it can cause a whole host of symptoms that span pretty much every organ system, from gynecological symptoms such as painful periods, pelvic pain that can precede one's period, after one's period, all month long. It can cause a whole host of gastrointestinal symptoms such as constipation, diarrhea, bloating, and it is often misdiagnosed as irritable bowel syndrome. Others have urological symptoms such as urinary urgency or frequency, and if you can believe it, it is responsible for 40% of unexplained infertility.
Wow.
And what happens from symptom onset to diagnosis in the U.S., there's a diagnostic delay of roughly a decade. So that means someone is suffering from the onset of symptoms till they're diagnosed almost 10 years. And then once one is diagnosed, most have the wrong surgery. The proper surgery being excision of endometriosis. So it's just devastating in every aspect of the disease.
You were saying, Sarah, that you started feeling something was wrong, feeling these symptoms at the age of 15. That is so young. And you didn't get your diagnosis until you were well in your 40s.
Yeah, so I can recall having mysterious symptoms.
Yeah.
Of course, the first thing I did was talk to my parents, and my parents didn't quite understand what could possibly be going on with me. They did their best to get me to a doctor, to follow up with things, but nobody ever suggested that it could be endometriosis. And so I suffered for years and until I was diagnosed, which was in my mid-30s, and I was diagnosed via emergency surgery for a ruptured ectopic pregnancy. So I went from suffering to undiagnosed to having emergency surgery to getting my diagnosis and trying to understand what that even meant, to then trying to find access to expert level care.
Now let's talk about the film. Jenna, one of the patients in the film, explains how even after going to medical school as a nurse, she never heard of this disease. So let's take a listen to Jenna.
For years now, I've been sent to every specialist that makes sense based on my symptoms: OBGYNs, pulmonologists, cardiologists. They don't see a problem based on their specialty. No one's looking at the big picture.
The scariest thing is that Jenna is also a nurse. She's one of the most capable people that I know, and certainly when it comes to any kind of medical thing, she should know.
I thought that maybe I'm dying or I have some kind of rare disease. But then I go online and find that millions of women are going through exactly what I'm going through. The first time that I was told it could be endometriosis, I'd never even heard of it. And this was 6 years into me being a nurse, and really what I like to regard as really highly specialized and nationally acclaimed medical centers.
Doctor, why do you think endometriosis is still so misunderstood in the medical field?
What I often tell my patients is that I learned more in my first week of my fellowship than I learned in 4 years of medical school, plus 4 years of residency, which means I learned less in 8 years than I did in my first week of my fellowship, which was specifically targeted for endometriosis. And the reason being, one, the symptoms span all different organ systems, yet it's taught as a period disease, or it's confined to the pelvic area, when it's a systemic disorder that affects us from head to toe. So that's number one. Number two, the training in residency, still today, as much as when I was undergoing training, it's outdated. We are teaching information that's outdated over 20, 30 years. So the doctors who are on the front lines, the general OBGYNs, are missing the diagnosis. And we now know that most likely endometriosis is a disorder, or disease rather, that people are born with. There's a genetic component. So if the mom, the aunt, the grandmother has it, that a child or that fetus has a 7 to 10 higher likelihood of having the disease, meaning a 70 to 100% likelihood. So we need to be training the pediatricians to pick this up. We need to be training the gastroenterologist because of the whole host and the plethora of gastrointestinal symptoms. So by the time someone gets to their gynecologist in their 20s or their 30s, or they're suffering from infertility, we've missed that whole opportunity to pick up someone so early. So it's a combination of that plus the surgical training to do the proper surgery. Excision of endometriosis is very technically difficult. And OBGYN training is more of like a primary care field these days, where we're learning how to manage diabetes in pregnancy much more than being a surgeon. So those OBGYNs who are coming out, they don't know how to do the proper surgery.
Sarah, from what you've seen, what do you think, what effect does this maybe lack of access to expert care have on the patient?
Well, I would say the number one thing is the delay in getting an appropriate treatment for the disease. So if you want to focus on people who are dealing with a tremendous amount of pain that affects all these different areas of the body and impacts their quality of life, the lack of awareness and understanding with our medical providers and the medical system in general is the number one thing that blocks access to care. And when we want to look at